I, I'd like to show you something that I've been doing in a lot of cases. I've been doing this for a few years. I don't really talk about it a lot, but I think it's time to share. This is a patient who had orthodontics for a couple of years on the left. Now, if you notice their teeth are in a reasonable alignment, you'll see how this tooth is out compared to this tooth a little bit. This tooth is still rotated in a little bit. The two front teeth are still slightly protruding forward, and this tooth is a teeny bit longer than this. On the bottom, the lower teeth are still a minor to moderate amount of crowding. Now, at this juncture in an orthodontic treatment, for an orthodontist to go from here to here is not as simple as you think. And one of the reasons that people have braces on for a long time is the fine details. It's still a bit of an old-fashioned arc where you make adjustments. You have to react when the patient comes in. Maybe the wire shifts, maybe a brace breaks. So you might think to go from here to a perfect alignment is really fast, but it does, experienced orthodontists will tell you, take more time than you would think to go from a point in treatment where you're kind of a B plus alignment to an A plus alignment. So what I do is I oftentimes remove the braces when the teeth are like 80% of the way there, and then I finish things with Invisalign. And so if you look in this case, this shows the way the patient was before the Invisalign, and then this took 4 months without braces where you can brush better. You can notice the two front teeth are more inwardly aligned. They're not protruding forward. These two teeth are now totally level. The reason why this is very exacting, and here you can see the lower crowding and how it lines up nicely, is because this is all set on a computer. And if the movements are of a small amount, even if precision is required, it's so much easier using computers. Braces come off, patient's happy, you can have better hygiene, you can eat whatever you want. We do charge extra for this, but it's reasonable, and I think it's really an efficient way to practice orthodontics, to combine braces and then using Invisalign at the end of the treatment.